Native Americans have some of the highest rates of substance abuse.
Yeah, but some outpatient drug and alcohol treatment programs focused on Native Americans may have to cut back on services or possibly even shut their doors if proposed funding cuts to Arizona Medicaid happen on May 1st. ABC 15 investigator Ann Ryman visited a treatment center in Scottsdale that says it will lose 90% of its funding if a state proposal goes through.
When I came to treatment, I came with nothing. I literally had nothing.
Curtis Nez credits outpatient treatment with helping him stay sober.
It really was one of the best decisions I've made in my life.
Nez is one of hundreds of people served by Sunrise Native Recovery. It's a substance abuse treatment program that opened a year and a half ago, but it may have to close soon. The Arizona Healthcare Cost Containment System, known as Access, is proposing cuts to reimbursements starting May 1st. This affects reimbursements for some Medicaid patients who receive outpatient drug and alcohol treatment services. Instead of providers getting reimbursed for a percentage of charges, they would instead get a flat rate. For example, at Sunrise Native Recovery, their reimbursement is $1,300 per patient per day. That would drop to $157 per patient per day. Access says the change will save more than $1 million over 5 months. At Sunrise Native Recovery, Chief Administrative Officer Alan King says they won't survive the cuts.
We're estimating anywhere between 70 to 90%.
The reason this facility would be so hard hit is because all of its patients are Native American. Native Americans are enrolled in a special subset of Access called the Fee-for-Service program. And it's only the Fee-for-Service program that is facing these proposed cuts.
So our proposal is to at least give us more time so we can figure things out and talk with the Access program, let them really understand how it's going to impact the Native population.
King said the change appears to be an attempt to crack down on providers who are abusing Access funding. But he said the solution is not to cut funding for hundreds of providers and potentially thousands of people.
A lot of people are going to fall through the cracks. I mean, because there's going to be literally no services. It's heartbreaking.
Patients in managed care access programs will not be impacted. Neither will residential treatment centers, though some operators are joining the calls for Access to find a different solution for the sake of the people they serve. Gabriel Tomeno and Robin Byrne are co-founders of Purpose Healing Center, a residential treatment center in the Valley.
We'll have nowhere to send these patients. And ultimately what will happen is without that support, they will most likely use or drink again.
People are going to die, which is the bottom line. People are going to relapse because the support services aren't there.
As for Curtis Nez, he has a job and is studying to be an electrician technician. He wants others to have the same help and support he received.
I'm living proof. I'm 16 months sober. I would like to say that I wouldn't be here if it weren't, for Access funding, programs like the one I went to.
Access declined an interview request from ABC 15. In a statement, they said their proposal is based on an analysis of rates in states that are comparable to Arizona. Some treatment providers may see a reduction in reimbursement based on how they currently bill, and most of the affected patients are Native American. I'm investigator Ann Ryman, ABC 15, Arizona.